posterior triangle of neck boundary anteriorly by the sternocleidomastoid muscle, posteriorly by the trapezius muscle, and base is by the clavicle. So anterior boundary, that is the posterior border of the sternocleidomastoid muscle. Here the sternocleidomastoid is the origin from the sternum, manubrium sternum, and this is the sternal origin, and then it is a clavicular origin of the sternocleidomastoid. Posterior boundary, it is anterior border of the trapezius muscle, and base is formed by the clavicle. Middle third of the clavicle, and apex is formed by the meeting point of the sternocleidomastoid and trapezius muscle. So this triangle so this is the sternocleidomastoid muscle, trapezius muscle, here it is a clavicle. So the posterior triangle is divided into the occipital part and supraclavicular part by the inferior belly of the omohyoid. Here it is the superior belly of the omohyoid, it is the intermediate part, and inferior belly of the omohyoid that goes below the trapezius muscle, and it originates from the suprascapular notch, just beneath the suprascapular notch. So when we see the boundary, posterior border of sternocleidomastoid muscle, posteriorly anterior border of trapezius, inferiorly middle one third of the clavicle, and apex lies on the superior knuckle line where the trapezius and sternocleidomastoid muscle meet. Now the roof of the fossa, that is formed by the investing layer of the deep cervical fascia roof and the superficial fascia over the posterior triangle contains the. So when we see from the above to below, there is a skin, superficial fascia, and deep cervical fascia. So which are the structure in the roof? That is the platysma muscle, external jugular vein, four cutaneous nerves, arteries, and lymphatic vessels. So here we can see the transverse section of the neck at the level of the seventh cervical vertebra. At the level of the seventh cervical vertebra. So here is the C7 vertebra, spinous process, transverse process. So when we see the superficially skin, superficial fascia, and here it is the deep cervical fascia. So where the posterior triangle of the neck is there, this is the C7 vertebra, this one is the anterior portion, this one is the posterior part, okay, right part and left part. So here is the prevertebral muscles and paravertebral muscles. So here we can see this green color layer, it is a deep cervical fascia. So here one is the sternocleidomastoid muscle. So here there is a posterior boundary of the sternocleidomastoid, anterior border of the trapezius muscle, posterior border of the sternocleidomastoid muscle, and here is the deep cervical fascia. So and below the deep cervical fascia, this is the posterior triangle. and here around the vertebra, anterior to the vertebra, this layer it is a prevertebral layer. It is the prevertebral layer. So between these two layers, it is the content of the posterior triangle of neck. Here it is the floor of the posterior triangle, and here one is the nerve that arises from the corresponding root. So again the roof, the muscles in the roof is platysma muscle, external jugular vein, four cutaneous nerve, arteries and lymph vessels. So here we can see this vein, it is external jugular vein. So the external jugular vein runs over the sternocleidomastoid muscle. Then in the lower part of the triangle, it pierces the deep fascia and it joins with the vein in the subclavian vein. So wall of this external jugular vein is fused to the cervical fascia. So in the superficial fascia, we can see the four nerves. Okay. That are the, here one is the, this one is the lesser occipital nerve, great auricular nerve, transverse cutaneous nerve and supraclavicular nerve. So four set of nerve. These are the cutaneous nerve that pierces the deep fascia, that pierces the deep investing layer, deep fascia, and goes into the superficial fascia and it supplies the skin. So this is the lesser occipital nerve. So this one is the lesser occipital nerve. This one is the great auricular nerve. This is transverse cutaneous nerve, and these three are, there is a common one trunk for the supraclavicular nerve, and then it divides into the three branches of the supraclavicular nerve. So from where these nerves are arises? So these nerves are arises from the cervical plexus. So here we can see the cervical nerve. So how the cervical plexus is formed? Cervical plexus is formed by the upper four cervical nerves. So when we see the cervical nerve, so here there is a spinal cord, ventral root, dorsal root, trunk of the corresponding spinal nerve, and then it divides into the ventral rami and dorsal rami. Here the dorsal rami gives supply to the back muscles in all over the body, and ventral rami supplies the other muscles supplied by the ventral rami. So this ventral rami from the plexus it forms the cervical plexus. So how the cervical plexus is formed? Cervical plexus is formed by the upper four cervical nerves, C1 nerve, C2 nerve, C3 nerve and C4 nerve. Ventral rami of the C1, C2, C3 and C4 nerve. Now what happened this nerve? There is a communicating loop between the upper four nerves. C1 and C2 communicate, C2 and C3 rami communicate, C3 and C4 rami communicate. So now the nerves arising from the C2. The nerve arising from the C2, it is the lesser occipital. it is a lesser occipital nerve. Okay? So this one is now it is a lesser occipital nerve. Then from the C2 and C3 arises a greater auricular nerve. This one is the greater auricular nerve. It goes up to the neck of the around the mandibles and it supplies the skin around the auricles. Then the transverse cervical nerve. This C2 and C3 arises the transverse cervical nerve, and it goes over the sternocleidomastoid muscles and supply the anterior part of the skin, lateral and anterior part of the. Then there is a supraclavicular nerve. So it arises from the C3 and C4 fibers, and this is the supraclavicular nerve from the common trunk, and then it divides into the three supraclavicular nerve, and that pierces the clavicle bone. Okay, so here one is the lesser occipital nerve, great auricular nerve, transverse cutaneous nerve or transverse cervical nerve, and supraclavicular nerve. These are three branches of the supraclavicular nerve. So which are the content of the roof? So content of the roof is skin, superficial fascia. It contains the platysma muscle. There is a thin layer of fat. It is a platysma muscle. Then external jugular vein, cutaneous nerve, arteries and lymphatic vessels. These are the content of the roof. So floor of the triangle, so boundary anteriorly sternocleidomastoid muscle, posteriorly trapezius muscle. And here is the clavicle, sternum, manubrium sterni, scapula. Process of the spine of the scapula and acromion process. So the floor of the posterior triangle, it is formed from above to downwards. So semispinalis capitis muscle, splenius capitis muscle, levator scapulae muscle, scalenus medius muscle and scalenus anterior muscle. So these muscles form the boundary of the floor of the posterior triangle. Here posterior part of the skull, occipital part of the skull, here there is a superior knuckle line where there is the attachment of the trapezius and sternocleidomastoid muscle. So above to downward, so the main muscle that forms the floor of the posterior triangle, it is the splenius capitis muscle, levator scapulae muscle and scalenus medius muscle. And also the boundary is formed by the above by the semispinalis capitis, below it is by the scalenus anterior muscle, and also sometimes here we can see the scalenus posterior muscle. So levator scapula, that is attached to the medial border of the scapula, scalenus anterior and scalenus medius muscle that attach to the first rib. So here we can see this one is the scalenus anterior muscle. So from by the scalenus anterior muscle, posteriorly there is a subclavian artery, trunk of the brachial plexus, and posteriorly there is a scalenus medius muscle that attach to the first rib, and above that are attached to the transverse process of the cervical vertebra, upper cervical vertebra. Now the content of the posterior triangle. So nerves, vessels and lymph node. By the posterior belly of the omohyoid, the upper part it is known as the occipital triangle and lower part it is known as the subclavian triangle or suprascapular or supra or subclavius triangle above the clavicle muscle. So occipital triangle, the nerve content, that is the spinal accessory nerve. Then the four cutaneous branches we have seen earlier that arises from the cervical plexus, and these are the cutaneous branches. So these cutaneous branches that content, and then it goes pierce the deep fascia and goes into the superficial fascia and supplies the skin. So the branches are the lesser occipital nerve from the C2, great auricular nerve, fiber arises from the C2, C3, anterior cutaneous nerve or transverse cutaneous nerve or transverse cervical nerve, C2, C3 and supraclavicular nerve, fiber arising from the C3 and C4. Also the muscular branches arises from the C3 and C4 fiber. It is for the levator scapulae muscle, then fiber from the C3 and C4 for the trapezius muscle, and now to the rhomboideus muscle C5. And the vessels. Vessels is the transverse cervical artery and vein and occipital artery. And the lymph node. The lymph node lies along the posterior border of the sternocleidomastoid muscle, more in the lower part, that is the supraclavicular node, and few at the upper angle, it is the occipital node. Now in the lower part of the triangle, what is the content? That is the root and trunk of the brachial plexus, now to the serratus anterior, now to the subclavius and suprascapular nerve. And vessels are the subclavian artery and subclavian vein, especially the third part of the subclavian artery and subclavian vein, suprascapular artery and vein, and commencement of the transverse cervical artery and termination of the corresponding vein, and external jugular vein, lower part of the external jugular vein that pierce the deep fascia and drain into the subclavian vein, and supraclavicular lymph node. So content in the upper part of the posterior triangle, the nerves are the four cutaneous nerves. Here there is a spinal accessory nerve, lymph node, then occipital artery. Now the content in the inferior part of the posterior triangle, it is a upper three trunks of the brachial plexus, subclavian artery and subclavian vein, third part of the subclavian artery. And there is a branches from the subclavian artery that appears in the triangle, that is the transverse cervical artery. So first see the branches of the subclavian artery. So this subclavian artery, brachiocephalic trunk, right-sided, and it divides into the common carotid and subclavian. Left-sided, it directly arises from the arch of the aorta. So the first part of the subclavian artery, the branch is we are going to see the branches of the first part, that is goes into the vertebral artery. In the vertebral foramen, here there is a internal thoracic artery, thyrocervical trunk. Posteriorly there is a second part. From the second part it is a costocervical trunk, and from the third part of the subclavian artery it is a dorsoscapular artery. Okay, so the subclavian artery that grooves on the upper part of the first rib behind the attachment of the scalenus anterior muscle. Here see the branches of the subclavian artery. So here is the thyrocervical trunk, costocervical trunk, and this one is the dorsoscapular artery. So remember the thyrocervical trunk, it gives a transverse cervical artery and suprascapular artery. Costocervical trunk, it gives branches, that is the deep cervical artery and superior intercostal artery. Okay, it's a little tricky to remember. So thyrocervical trunk, so we can see the superficial cervical artery or transverse cervical artery. Okay, it and suprascapular artery both arises from the thyrocervical trunk. From the costocervical trunk arises the cervical, means deep cervical artery, and supra the that supplies the intercostal muscle. So superior intercostal artery, so that arises from the, see here again, this is the clavicle, this one is the first rib, spine of the scapula, acromion process. Here there is a thyrocervical trunk. Okay, so this one is the suprascapular artery. Okay, so here there is a suprascapular notch. Okay, so this one is the suprascapular artery, this one is the transverse cervical artery, and this is the costocervical trunk. Okay, so in the costocervical trunk, this is the deep cervical artery. Okay, it goes upward adjacent to the vertebra. Then the superior intercostal artery that supplies the artery in the upper two intercostal space. From the superior intercostal artery arises the posterior intercostal artery. So now the content, we have seen the content. It is a spinal accessory nerve, four cutaneous nerve, muscular branches to the floor of the posterior triangle. Here there is a transverse cervical artery and vein, that is the branch of the subclavian artery, the occipital artery. Okay, now the occipital artery, so here there is a external carotid artery opposite the hyoid bone, that arises the, in the anterior part arises the facial artery, and opposite to the facial part from the posterior side arises the occipital artery. So the occipital artery goes upward posteriorly and up to the occipital area. So this one is the occipital artery. So content, so vessels, clear about the vessels, transverse cervical artery and vein, and occipital artery, lymph node. Now the subclavian, one more content remain, it is the spinal accessory nerve. Main content of the occipital artery, occipital triangle, that is the spinal accessory nerve, these four cutaneous branches in the upper part of the triangle. So the 10th cranial nerve is the spinal accessory nerve. This spinal accessory nerve arises from the upper 5 roots. Upper part of the spinal cord, upper 5 roots in the anterior, the fiber derives from the anterior horn of the spinal cord. This fiber runs between the two roots, ventral root, dorsal root, goes upward. These are the fiber of the accessory nerve, 10th cranial nerve. It has a two parts. These are the spinal parts and this one is the cranial part. Okay, this part it is the cranial part. So this spinal part goes upward, passes through the foramen magnum. It united with the cranial part of the accessory nerve and it comes out through this jugular foramen and then it passes downwards posteriorly and laterally and it enters into the posterior triangle, passes behind the sternocleidomastoid and it enters just below the deep fascia, just below the floor, just below the roof, below the deep fascia. So here one is the spinal accessory nerve. Okay. So when we remove the skin, superficial fascia, investing layer of the deep fascia or deep fascia. So just below the deep fascia, the spinal accessory nerve is plastered below the deep fascia. Okay. So it is a content of the posterior triangle in upper part, but it is a more superficial. Now, so spinal accessory nerves are the occipital triangle, spinal accessory nerve, four cutaneous branches, muscular branches to the floor, vessels, lymph node. Now in the lower part of the triangle, there is a roots and trunks of the brachial plexus. So in the brachial plexus, it arises between the anterior to the between the scalenus in anterior and scalenus medius muscle, three trunk of the brachial plexus and branches from the root of the brachial plexus. So from the C5 root, it is a dorsal scapular nerve, 5, 6 and 7 root. There is a nerve to the serratus anterior muscle, C5, 6 and 7, now to the serratus anterior muscle, then now to the subclavius and suprascapular nerve. So the now to the subclavius and suprascapular nerve, these are the branches from the upper trunk of the brachial plexus. So only the upper trunk gives the two branches. From the three trunks, upper trunk, middle trunk and lower trunk, only upper trunk gives a branches, that is the ups point. So the nerve to the subclavius and suprascapular nerve. So here the upper trunk, middle trunk and lower trunk. Okay, from the upper trunk ups point, suprascapular nerve and nerve to the subclavius. From the C5 roots, there is a dorsoscapular nerve, 5, 6 and 7. This is long thoracic nerve or nerve to serratus anterior. Now the vessels, it is the subclavian artery, subclavian vein, suprascapular artery and vein, then the transverse cervical artery and corresponding vein and lower part of the external jugular vein that pierces the deep fascia. So here we can see there is a subclavian artery in front of the scalenus anterior muscle. There is a subclavian vein and the transverse cervical artery, that is a branch of the thyrocervical trunk. Transverse cervical artery and suprascapular artery. Transverse cervical artery and suprascapular artery, branches of the thyrocervical trunk. Lower part of the external jugular vein, this one is the external jugular vein that pierces the deep fascia in the lower part and drain into the subclavian vein. So clinical anatomy related to the external jugular vein. So in the supraclavicular space, when there is an injury to this nerve or division of the nerve in the supraclavicular space, when this nerve is cut, it causes air embolism and consequent death because the cut end of the vein are attached to the deep fascia and it prevents it from the retraction and closure by the fascia. So it results in the air embolism. So we have to cut the fascia to release the pressure over the vein. So here is the spinal accessory nerve. There is a lymph node around the spinal accessory nerve. There is an infection, enlargement of the lymph node, result in the irritation of the spinal accessory nerve. So the spinal accessory nerve is plastered to the roof of the posterior triangle. So we can see the deep deep fascia, skin, superficial fascia and deep fascia. So deep fascia forms a carpet, okay, and behind this deep fascia, the spinal accessory nerve is attached to this deep fascia. So when there is an injury to the roof, of the posterior triangle, they may result in the lesion of the nerve, okay, lesion of the spinal nerve. So this result in the paralysis of the sternocleidomastoid muscle that result in weakness in turning the head to the opposite side. So paralysis of sternocleidomastoid muscle and also it affects the trapezius muscle. So there is a loss of the normal contour of the shoulder. So there is a dropping of the shoulder muscle. So anesthetic block. To produce the anesthesia in the neck, the anesthetic agent is injected at a several points. This anesthetic agent injecting as a several point, especially around the middle of the posterior border of the sternocleidomastoid muscle. Middle of posterior border of sternocleidomastoid muscle. So when during the anesthesia of the upper limb, and for the upper limb, anesthetic agent is injected in the posterior triangle superior to the midpoint of the clavicle. So anesthetic agent is inserted into the superior to the midpoint of clavicle. And supraclavicular nerve. So for the upper limb, anesthetic agent is inserted superior to the midpoint of the clavicle in the trunk of the brachial plexus. So in above the clavicle, in behind the scalenus anterior muscle, there is upper, middle and lower trunk of the brachial plexus, and also there is a injury of the supraclavicular nerve following fracture of the clavicle. Lateral fracture of the clavicle at the lateral 1/3 and middle 2/3 of the clavicle. Now the subclavian artery. Pressure point of the subclavian artery, it is in the lower part of the posterior triangle. The artery can be palpable by pressing immediately behind the junction of the medial and middle third of the clavicle. This is also a pressure point of the artery. The artery can be compressed against the first ridge here. Okay, so we can palpate the subclavian artery above the clavicle, midpoint of the clavicle, behind the sternocleidomastoid muscle. And we can compress the artery at the junction of the middle third and medial third of the clavicle against the first rib. This is the pressure point of the subclavian artery. So when the hemorrhage occurs, artery can be compressed here. Sternocleidomastoid muscle So when there is applied related to the sternocleidomastoid muscle. So sternocleidomastoid muscle, Wryneck or torticollis. So in the Wryneck or torticollis, the head is bent to the one side and chin is point to the other side. This is due to the spasm of the sternocleidomastoid muscle and trapezius muscle, because both are supplied by the spinal accessory nerve. So spasmodic, there is a three types of the torticollis: spasmodic torticollis, reflex torticollis, and congenital torticollis. In spasmodic torticollis, there is a repeated painful contraction of the trapezius and sternocleidomastoid on the one side. This is due to the cold and maladjustment of the pillow during sleep. Reflex torticollis occurs due to irritation of the spinal nerve caused by the inflamed or suppurating lymph node, and congenital torticollis occur due to birth injury.